Hello there, my name is Geronimo Smith. I've been sent here today to interview you.
Hi, my name is Alexander Mugam. I'm a student from Western Sydney and I'm here to do my interview.
Are you ready to go?
Yes, I am.
Ready. So, Alex, question one. Considering the NMBA standards for practice that govern your nursing practice, how will you deal with the following scenario? It is your first rotation as a new graduate nurse, and your patient who needs to remain in bed is agitated and demanding to go for a cigarette. The patient stated that they are not satisfied with your care. How would you handle this situation? Reflect on how you would handle the stress of the job.
Well, I would go over to the patient that is agitated to try and de-escalate the situation. I would state who I am, my role and position, remain calm, and ask them to tell me what exactly about their care that they are not satisfied with. I would actively listen to the patient's complaints, absorb what they are saying to me, and apologize for any delays or neglect that they feel that they are experiencing. So I'd reaffirm to the patient that the ward and hospital prioritizes optimal patient care as it is our number one goal. In accordance to the Nursing and Midwifery Board of Australia standards, specifically Standard 2, which relates to nurses engaging in a therapeutic and professional relationship. If it's more of a medical related issue, I would follow it up with their medical officer. If the patient's behavior becomes out of control and they start to become increasingly aggressive or abusive, I shall escalate the situation to the NUM of the ward or the most senior nurse and await further instructions from them. Depending on how agitated the patient becomes, I might have to escalate the situation further to the hospital security. This is due to the fact that in accordance to the NMBA standards, specifically Standard 6, which states that nurses must provide safe, appropriate, and responsive quality nursing practices, as I am also responsible for the safety of that patient who is agitated, my other patients, my other colleagues, and any visitors in the ward. I need to take all of these factors into consideration and need to make the best form of action that will result in the best outcome. But it all depends on what the NUM and senior nurse suggests once I've escalated the situation. In terms of the patient having a cigarette, I am aware that patients are allowed to go on hospital premises to have a smoke. However, before allowing the patient to leave the ward, I would first read the notes and make sure that he is allowed to go outside, as he could be a scheduled or involuntary admission. If I am unsure, I would ask for help. If the patient isn't allowed to leave the ward, I would ask and find out if there are any other alternatives to cigarettes that he would like that would help him calm down, such as tea or any other alternative that is appropriate to the ward and to the hospital. If he is allowed to step outside of the ward for some time, I would make sure that they are no longer agitated, as again, if they leave the ward agitated, they could pose a safety risk to others. I would document the events that unfolded on that shift for that patient and hand over the event through ISBAR to the next rostering staff. I would also debrief with my clinical educator, reflect on my day, reflect on how I handled the situation and the things that I could possibly do better the next time and apply it to that practice. I would also actively listen to my educator, any other nurses or the NUM, and actively listen to the feedback that is given to me, so then I can also apply that to my nursing practice.
Alright, Alex, so question two.
Yep.
Nurses have to comply with occupational health and safety standards. Please describe a time you had to deal with an unsafe situation and how you handled that.
So during one of my clinical placements, the nurse that I was working with told me to shower a patient. This wasn't an issue as I had showered patients before. However, when I was looking at my handover sheet to see how the patient mobilizes, I noticed that they were a two-person assist when mobilizing to the commode chair. I relayed that information to the nurse that I was working with, and she said that it didn't really matter, and she believed that the patient would be safe enough to mobilize with just a one-person assist. The nurse that I was working with also stated that because we were busy at the time on the ward and had lots of tasks to complete, that the work had to be divided up, and having two people for mobilizing one patient to the commode chair would be a waste of time. She also insisted that because I was young, that I would have the strength and energy to do it on my own. Even when I asked the patient themselves how they normally mobilize to the commode chair, they said that they were very unsteady and they did indeed need two people to assist them to the commode chair. As much as she peer pressured me, I knew that what she was telling me to do, the nurse, I knew that what she was telling me to do was the wrong thing. So I refused to mobilize the patient by myself. The reason that I refused is because if I mobilized the patient by myself, then he could easily have fallen or injured himself, or I could have injured myself. This was not proper manual handling and goes against ward and hospital safety standards and OH&S policies. These safety standards and OH&S policies are in place to keep patients and staff safe by minimizing the risks of injuries when manual handling. The nurse wasn't too happy when I refused to mobilize the patient by myself. So the patient was showered instead later during the shift when I had help from an AIN on the ward. And she helped me, the AIN, mobilize the patient to the commode chair. I told the NUM of that ward what had happened, as I believed this was a very unsafe practice culture which needed to be rectified, and I debriefed the situation with my clinical educator. I documented what happened on the shift and also reflected on what happened and absorbed the advice given to me by my clinical educator should a similar situation arise again.
All right, Alex. So third and final question. Question 3.
Yeah.
The completion of your bachelor's degree is only the foundation of your development as a professional nurse. Ahead of you, there is a lifelong of learning and autonomy. After obtaining employment, what is your long-term career plan or commitment to professional development?
So my long-term career plan is to learn as much as possible, to become the best nurse that I can be and work in the emergency department. As a new grad registered nurse, I will work within my level of experience and scope of practice. I will be a safe practitioner, meaning that I will always follow ward standards and protocols. Never do anything that I am not completely confident in, and always ask questions or for assistance if I'm unsure. I will always ask for guidance and to be sure how I do any procedure if I am unsure. I would also look at the ward's policies and protocols so that I am aware if I am doing the right thing. I could also look on SIRE and other sources on the hospital intranet for policies and procedures or any other information that will enhance my patient care. I am very invested in my personal and professional development by taking on any feedback that is given to me and reflecting on that feedback to better enhance the way that I practice my nursing. I will ensure that I am continually building my knowledge. I will also look on SciApp and other sources on the intranet for policies and procedures or any other information that will enhance my patient care. I am very interested and invested in my personal and professional development by taking on any feedback that is given to me and reflecting on my feedback to better enhance the way that I practice my nursing. I will ensure that I am continually building my knowledge, as nursing is a continual learning process. I shall do this by seeking out information from research papers and expertise from other nurses, doctors, and members of the multidisciplinary team. I'll apply any new knowledge to the development of my work within my scope of practice. I will practice and become very good at time management and at problem solving by always making sure that targets and goals are met by their deadlines and prioritizing my most important tasks first. If there are any situations that doesn't sit well with me, then I will immediately escalate it to the nurse educator or the nun. And again, my long-term goal is to be an emergency department nurse. I've been working in emergency as an AIN for about over 2 years, and I've always had a passion for the emergency department. Mostly, I plan to stay there for as long as I can. And also, to ensure continual and professional development, I shall complete a postgrad study in emergency care.
All right, Alex. So we've concluded your interview for today.
Thank you very much for your time. I really appreciate it.
You're fine. Thank you.
Thank you.